Okay, welcome back to our second lecture in part 4. And in this lecture, we're going to be talking about how to critically review an AIML publication. So why critically appraise AIML studies? Well, for the same reasons you'd critically appraise any, research study from the medical literature. The positive effect that AIML is having on medical research is that it is bringing collaborative research to the forefront. And the reason for that is because you can't just do it isolated. You need people from various fields collaborating together in order to produce the best artificial intelligence solution. And so inevitably you have, researchers from math, stats, computer science, computer engineering, electrical engineering, software development that are working with the medical research community in order to put together these artificial intelligence solutions. But because of that, there is a need for us to be able to continue to apply internationally recognized standards of reporting for research. And the medical community, of course, is very used to this because evidence-based medicine is now the current practice. And so the challenge is going to be folding in all of these other disciplines into this standardized way of reporting that we're so used to. Now, a recent systematic review meta-analysis from this year conducted an evaluation of AI for disease diagnosis using medical images, and they focused on deep learning models, and the review identified more than 20,000 studies in the field, and according to their strict, obviously, inclusion criteria, less than 1% of these studies had sufficient, quality of design and reporting standards in order to be included in their meta-analysis. Now, of course, this is just one example. It doesn't mean that all of or most of the studies out there are flawed. No, it gives you some perspective in terms of the importance of correct reporting and quality of study design. Here's the outline for this lecture, for the lecture 2, part A and B. And we are starting off with how we can actually evaluate artificial intelligence and machine learning. And we will follow it through all the way to the end where we will look at if the performance is reproducible and generalizable. So a first important criteria is going to be pre-specifying the study methodology. And when you do so, you should include, of course, a description of the unmet need that you're addressing, the intended place of the model within a diagnostic pathway, the inclusion-exclusion criteria of the study, of course, the approach to how you will validate your algorithm, the primary and secondary outcomes that will be evaluated, the power calculation, of course, and the statistical analysis plan. So a lot of it is criteria that you are accustomed to, but there are a few additional ones that you need to be aware of. Always look for a clear purpose and one preferably that has been stated a priori, so meaning before the work has begun. This, of course, will minimize some of the possible biases, including the classic publication bias. Always look for the basics, of course, for instance, like sample size calculations and statistical analysis plans that are produced ahead of time, so before the data is collected. Now, the additional challenge in the world of machine learning, and especially machine learning with medical images, is the sample size calculation. There's no easy way of calculating this. It is typically done based on previous experience as well as knowledge of the content, so the data content knowledge, as well as a pilot model, so meaning that some previous experience working with the data that will allow the researcher to provide a more detailed sample size requirement based on their experience with the actual data and training of that data. Now, a few things you should ask yourself, especially in this new world of artificial intelligence and machine learning methodology, because you will need to choose the appropriate evaluation metrics to report. You will also need to choose the appropriate calculation for your error in order to perform optimization on your model. And so some of the questions that will help you make those decisions is, will this test be used for triage or diagnosis? If it's used in a triage situation, specific test requirements relevant to mass screening could or could not apply. Will this model be used as an isolated test? Will it be used in combination with other diagnostic tests or elements? Will it be used as an add-on or replacement? All of these will impact how you design your research. If the machine learning model is a component of the diagnostic decision tree, researchers should also define how the information arising from the model fits within the overall diagnostic probability function. Something to be aware of, selective reporting, where the study is reported, but only those outcomes that show the model as a success are reported. Need to be aware of this. Often happens when you have conflict of interests, especially financial interests involved. How can we address it? Well, very simply, prospective registration of your study, just like in the pharma world. Is that something that's commonly done? No. Is it something we should move towards? Yes. Important, of course, is understanding the intended use of your machine learning model in the diagnostic process. And this is something that you want to think about or include or involve right from the get-go of your project. Documenting this, of course, enhances transparency. And when you do evaluate it, you're going to want to ask yourself, was this only tested in an experimental setting, or was there, can we show a meaningful impact in a population that's similar to the one that was used for training? And this, of course, is generalizability. And in this case, or in the case of machine learning, this is an extremely important step. This brings us to whether the model is being evaluated in its intended stage in the care pathway. So very often projects will involve diagnosis, and at each stage, whether it be the presenting history, clinical examination, or a series of investigations, what constitutes an individual data point along this stepwise diagnosis process is what you need to determine. The diagnosis is a process of integrating information derived from all of these various stages in the patient pathway, and therefore this needs to be considered. So whenever developing a new test or algorithm, it is always important to take into consideration where the data set came from in the care pathway. And the reason you do this is because when you provide the final diagnosis decision, you always want to provide some clinical context, in the sense that you want to know what's the pre-test probability of the disease, as well as the ability of your algorithm in order to make the diagnosis or identify the disease, because it's the combination of the two that's going to provide you with the post-test probability that should accompany your diagnosis decision. When dealing with pre-curated data sets, which we most often do, this is also called retrospective data, it is always important to find out what the purpose was for the original data set. So why was it originally curated or collected? We also need to know, does the disease probability within this cohort or within this data set differ to the setting in which the model will be deployed, which means, once again, is it going to be generalizable? In this case, we definitely need to be aware of this when we do the training and we report our findings. We need to definitely express as well that it was what we trained on, similar to what we plan to apply it to. Once again, this is going to be able to provide the post-test probability that if you are positive for the test, that you actually have the disease. Now, this should sound familiar to you. One of the questions you should be asking is, do the authors provide sufficient clarity on how the data were split in order to do the training? You remember from the previous lecture on the importance of this. And what you need to be looking for is whether or not the authors provided sufficient information for someone to validate what they did. This is the same as reporting any type of methodology in your research papers, where because it's a scientific paper, you need to be able to describe your process in sufficient detail so that someone could actually reproduce your results and verify that what you are reporting is true. Here's a nice slide that provides a little more detail on the data split concept. You can see here in this figure that you start with model development. In this case, this figure calls it a training set and a tuning set. What we've called it in the past is the training and validation set. That is used for developing the model. You then have remember that section of data that you hide away and never look at until you are happy with your algorithm. That's called your test set. It is now here in this slide called your internal validation test set. Same thing. And that is what we've seen before, but this slide provides you with a little extra that in order for you to evaluate your model and maybe bring your algorithm to a clinical setting, you then need an external validation test set. This is most often required for regulatory compliance, and this is where you're going to have a separate data set specifically for model validation, and very often it is a prospectively collected data set. Okay, the next question to be asking is, are the image labels likely to reflect the true disease state? In the world of machine learning and artificial intelligence, we often refer to the ground truth when we would like to assess the accuracy of our predictions. In the world of medical research, in what is often used by clinicians, is the gold standard. Now, this is a bit of an issue when we're working in machine learning and artificial intelligence because of the problem that the gold standard is often coming from multiple sources because the data set we are using is extremely large. And this is something that you need to be aware of, and you need to validate that you are using the same gold standard across your entire data base, as well as how the gold standard was set or obtained in the various sources that your data set represents. Now, in medical research, we are often confronted with the problem of imperfect gold standards, which means that it's the best that we can get in terms of an answer for knowing the truth. Very often this turns out to be the expert's opinion. Is that a problem, or is it any different for machine learning? No, but we just need to assess the reliability of expert opinions and just be mindful that our data sets are extremely large, and so inevitably there will be a variety of different experts that contributed to the data set. And just remember that the more measurement error that's introduced into your model through, for instance, using multiple experts, you are going to be introducing effectively noise, which makes it more challenging for your model in order to be successful at accurately predicting your outcome. Now, something to consider: were the images labeled prospectively or retrospectively? Now, interestingly, as I'm sure you remember from your epidemiology class, most often you'll say, whoa, retrospective studies are not as powerful as a prospective study, and that is true. But just to note that in some situations, retrospective labeling may be beneficial as it benefits from additional information, such as, follow-ups, confirmations of comorbidities, confirmation of the diagnosis that you're interested in, and that will provide you with better labels. But fundamentally, the question is, how confident are you that the labels you are using are indeed the ground truth? Next, of course, is how do you report your diagnostic accuracy? As we discussed in our previous lecture, there needs to be a clear and explicit way to express the accuracy of your model. And don't forget that the accuracy is, or the way you describe your accuracy is context specific. And in the world of medicine, most often it is very important to express the sensitivity, the specificity, the area under the curve, which represents the overall accuracy of the test, or in this case, the algorithm. Here's a nice summary slide that provides the differences in nomenclature for machine learning and classical statistics, which is what we use in medicine. It also provides the two evaluation metrics, accuracy and F1 score, which are used quite commonly in the machine learning world. All right, the next question to ask when assessing an AI/ML study is whether the dataset used in the model development is reflective of the setting in which the model will be applied. The concern, of course, is spectrum bias, which is a common problem because many investigators may opt for databases or data sets which represent extremes, which is, first thing that comes to mind, right? Get your data, get the normals, get the severe disease. But an underrepresentation of, certain diagnostic features or disease states when you're training will limit the algorithm's performance once it's released into the intended clinical area. So dealing with spectrum bias is pretty straightforward. Basically, you just need to make sure that you have the complete spectrum of diagnostic cues for the target population within your training set. Now, bear in mind as well that you have two challenges here. One is you would like to make sure that you have the complete spectrum of diagnostic cues, but two, you want to develop the best algorithm in order to classify or identify your disease. Now, it is usually much easier, much better to have balanced classes in order to train. And in order to do that, not only are you going to need to make sure you have all the appropriate classes and you have all the appropriate data or representative data in order to train to identify those classes, but you're also going to want to make sure that you have a somewhat balanced representation of your classes in your training set. Ways to deal with that: oversampling, undersampling. There's another way to call that, and it's called enrichment. So you enrich for certain underrepresented classes in order to make sure that your algorithm trains correctly on that class. But however, after having done all that, be sure to incorporate into your evaluation what we've discussed many times already, and that is the pre-test probability of having the condition, the disease, whatever you're trying to identify, coupled with the likelihood ratio of your algorithm, or likelihood ratio you've seen before when discussing diagnostic tests. It's the same thing. An algorithm is the same thing. And that will enable you to calculate the post-test probability of actually having the disease if your algorithm or your test identified you as having as positive for that disease. Next question is whether the output of the model is interpretable and can it be interrogated. An interpretable model that can be interrogated is one where the input parameters have been chosen by a hypothesis-driven and rule-based methodology. In machine learning, we have the black box decision-making problem. And what it refers to is that very often we have thousands of input parameters that have been derived or chosen by a data-driven process in the machine learning algorithm. And because it is not hypothesis driven and without supporting evidence, it is difficult to interpret or to interrogate such a model. And that is I guess, the pros and cons of machine learning. The pros, of course, is being able to leverage thousands of input parameters into in a very complex model in order to come to a solution. That's the pro. And then the con, of course, is dealing with the ability to interpret it and to provide evidence that this model is feasible in generalizing in the population of interest. Now, related to this challenge of having a model that is interpretable and one that you can interrogate is whether the performance that you have obtained with your model is reproducible and generalizable. Now, it is a very well-known problem that classification performance of predictive models, of course, including machine learning models, can be overestimated in your internal validation of your study. And the only way to know whether or not this is going to be a problem is, of course, when you validate in an external study. So as discussed before, the external validation is a crucial step if you would like to obtain regulatory compliance in order to use your algorithm in the clinical setting. So do your external validation sooner rather than later, because there is a chance that your algorithm will not perform to the required specifications for its use in the clinical setting when you've tested on your external data set. And if that's the case, you're probably going to have to go back and work on your algorithm a little bit more and then revalidate it once again on an external validation before you can get it into the clinical setting. It is for this reason that you should probably consider external validation as a continuum rather than a single event. It's not going to be something you're going to do once and say, ta-da, that's it. No, it's probably going to be something you're going to do regularly in order to make sure that your algorithm is still performing to the specifications required for the clinical setting. And it's also going to allow you to capture changes that may be occurring in your current population. So the one that you're applying the algorithm to, there may be new patterns that are emerging that your algorithm was not trained on that need to be identified and then incorporated into the training process. So when dealing with this external validation continuum, you are of course going to be working or wanting to work with an out of sample external data set, which means that it's going to come from a separate study population and be independent from what you did in the development phase or the research phase. You're also going to want to take into consideration the timing of your data set. So meaning when was it collected or when will it be collected? And also geographically, where was it collected? So where physically was the population that was sampled? And that brings us to the end of our questions. Here is a summary slide of all the questions that we asked. We started off with how we would evaluate our AIML. Were the models that were being evaluated in the intended stage of the care pathway? Do authors, so us, provide sufficient clarity on how the data was split? Are the image labels likely to reflect the true disease state of interest? Is the diagnostic accuracy reported? Is the data set used in the model development reflective of the setting in which the model will be applied? Is the output of the model interpretable and can it be interrogated? And linked to that, of course, is whether the performance reproducible and generalizable. All right, so we've gone through lots of questions you need to ask, lots of details to keep in mind. how are you going to keep track of all this? Well, luckily, there are new standards that are specific to reporting studies of machine learning interventions in healthcare that are currently being developed. The three that I recommend you have a peek at is the Tripod ML, the Spirit AI, and the Consort AI. My personal preference is the Consort AI, but that's just a personal preference. And of course, what it's hoped is that these standards will lead to improvements in the design and the reporting of our AI studies, which was the goal of the exercise at the beginning of this lecture. And that brings us to the end of lecture 2. That gave you a few tips on how to appraise AI/ML research studies. Yeah, it was a bit dry, but it's really important. Just you don't have to have it top of mind all the time, but when you're planning your research, pull out your Consort AI and say, okay, what do I have to make sure I don't forget? How can I avoid some of these biases? And the reason you want to do that is because you don't want to be playing catch up at the end. You do all the fun stuff, you do all the training, you get everything done, your algorithm's ready to go, you have fantastic accuracy, and then you start thinking, okay, well, how am I going to validate this, and how am I going to report this to the world so that everyone shares my excitement? And then you find out, I should have done it this way, I should have done that, I should have collected this. That's just really not the right time to do it. Anyway, next up in part 5 in our first lecture, we're going to talk about another fun topic, data ownership, data sharing, and ethics. I will see you there.